Okay, so let's talk about missing spacers. Spacers are little rubber bands that go between the teeth to separate the teeth and make a little space between them, so we can place sometimes expanders or other sort of appliances that are glued in the mouth from what's called bands, so rings around the teeth. So these spacers are placed typically around the back teeth, around the back first molars, which is that big tooth right there, the first big tooth that you come to, and they go between the teeth wherever there's contact. So if these spacers do fall out, first they can be pulled out if chewing gum is chewed or other sticky foods such as Laffy Taffy or Jolly Ranchers or Now and Laters, things like that. And chewing gum's the most common one that pulls out spacers. So why you have your spacers in? No chewing gum. They're typically left in about 2 weeks. The other reason they fall out is just they work really well and they make space between the teeth and then they just work their way out. So if your spacer does fall out, especially if it's been in a week or so, all you need to do is check that little space between your teeth with some dental floss, and you floss your teeth. If the floss goes through your teeth and it is hard to floss and it pops, then you need to come on back and we need to put another spacer in there. That means the space is closed. If you can just slide that dental floss up and down without resistance, that means that space is still open and we can put in and do what we need to do. We can deliver that appliance to you with no problem. So if a spacer does come out and you have it at home, what you can also do is try to replace it with a couple pieces of dental floss. So take your spacer, take 2 long pieces of dental floss, and thread one end of the dental floss through the spacer. Let's see that here. Okay, so you have one spacer with the dental floss around it. Now take your second piece of dental floss and thread it through that spacer again. Okay, so now you have 2 dental flosses going through the spacers, and now you have a handle for your spacer so you can pull and stretch out your spacer. And I'm going to demonstrate on the front teeth here. Typically you'd be putting this in the back teeth. And if the spacers do come out, they should be very easy to replace. So these plastic teeth don't have any space between the back teeth and they don't move like natural teeth. So we'll put it on the front one where there's a little space. So what you want to do is you want to wrap it around your fingers, and just like you're flossing your teeth, you want to push the spacer down and you'll hear one side pop. Okay, good. Now if it goes down totally below the contact, okay, but between your teeth, all you need to do is pull up just real gently until it's around underneath the tooth and then above the tooth. Okay, and then usually take your finger and hold the spacer there because it can come out pretty easily, and then pull out the dental floss one at a time, and then you have a spacer between your teeth once again. And as always, if it does fall out, you have any questions, please call the office and we'll be happy to answer them for you.